All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is our third show for today. This is the first day. We had done a morning show at 11 a.m. Pacific daytime time. I think that was a good time for European and Asian cool beans, or European and Asian beans. And then now this is the second show here in the US. Hopefully this is good for some of the countries here as well. Let's see, we would do this structure for a few days to see if that works and if it is a need for these separate chit chat times. If not, we'll wind it down. If yes, then we'll continue. My request to you that I need is please let's start structuring for how many days to give to COVID versus others. Should we? So right now we are studying together, exploring together for 6 days. Should we take 2 days out of it and then start giving that to diabetes and aging and other such things? You know, Luffy is singing the songs of his people over there. Luffy, he sometimes cracks me up with his intonation in his meows. So the aging, you know that from Project Phoenix, I have been thinking about aging and prevention of disease in the older age for a very long time. And so I think that is an area that is very near and dear to me. Diabetes is very near and dear to me because of the misery that it causes in the older age. So maybe aging, hypertension, cardiovascular issues, cancers, diabetes, these are some bigger areas to work with. So how many days should we do? 2 days and 4 days breakdown, then we can keep changing it as pandemic ramps down. I'm sure it's going to go away soon. So Simple Steve says, hit the like button, everyone. Yes, thank you very much. And so Ruby's and Red, is Ruby's here? Ruby's had made a comment that that felt like to me that Ruby thought that I actually believed that African American community or any other, when I'm saying that it was thought that they feel less pain, it's actually true that I believe. No, not at all. We all human beings have similar ways of feeling and our intensities. Actually, African American community is fragile in many, many ways. They're strong in many ways and they're fragile in many ways. So it's just a very sad thing. It disturbs me. For example, there's a very common example that is seen in medical field or shared in medical field, that there was a, and this is correct. Somebody had made a comment that this happens even after the slavery for the people who were incarcerated. Even now, America has the largest number of people in prisons, and then out of them, a largest number of population is actually African Americans. And if you see, a huge number is for very minor crimes, and there is a whole industry that is goes on that. Remember, a few days ago, a judge was arrested who used to sell black community members for jails. So it's a sad thing, and it is still going on much better, I think. But even when one person is in the jail incorrectly, for that person, it's gone. It's 100%. So the example I was giving was that there was a girl, African-American slave girl, whose owner wrote her for the experiments, and the doctor performed 17 operations on her for gynecological explorations, and none of them with any kind of anesthesia. And they believed that she was not feeling pain and she would not have enough sensations. And that's happened. Okay, so here Jenna's leaving. I have to get rest. Good night. Thank you, Dr. Mimi. Absolutely. Jenna, hopefully you're feeling better. So, Jody, Denise, friends. Rubies, the slaves were so, yes. So Rubies, I got you. I get you. Don't think that it infuriates me. It is the clearest example of systemic is yes. Okay, so all right. Let's start. How would you like to discuss? What would you like to discuss today? One thing that was interesting is that Europeans, of course, when I did the chit chat in the morning, I became a little more connected with the European side as well. So a couple of things that were interesting in the morning was that one European Medical Association, as I showed you, has come out and said no issues with the thrombosis. It's equal. Even if there is a link with thrombosis, the number of cases are so low that it is the benefit outweighs the risk. The other thing that they did, and I want to show it to you, it kind of made me angry, but I was saying to our European cool beans, some of the cool beans here were there as well in the morning. I was saying to European cool beans that I'm already upset with CDC and FDA and NIH and WHO. Now I'm going to be upset with EMA as well. So here, EMA, European Medicines Agency, EMA advises against use of ivermectin for the prevention or treatment of COVID-19 outside randomized clinical trials. How idiotic. So I think that sometimes my mother used to say that if you don't have something useful to say, just keep your mouth shut. If they don't have anything useful to say, they should just keep their mouth shut. I think that is better than coming out and doing these kind of things. So what they're saying here is that somehow ivermectin has not shown any efficacy or results, or good studies are not done. And check this out. Although ivermectin is generally well tolerated at dose authorized for other indications, side effects could increase with much higher doses that would be needed to obtain concentration of ivermectin in the lungs that are effective against the virus. Toxicity when ivermectin is used at higher than approved doses, therefore, cannot be excluded. And they're talking about the original Callies from Australia, the research where he had used a concentration of ivermectin that was much greater. Still, he had said that the cells did not die. But important thing is that since then, there have been so many doctors. Remember, there was Dr. Alam from Bangladesh who did ivermectin with doxycycline. And then there were so many other doctors, including myself, who used ivermectin successfully in therapeutic doses. And there are so many studies that have used ivermectin in therapeutic doses. So this thing over here, side effects could increase. So dudes, you guys are European Medicines Agency. Science, medicine, health, that is what you are. Why to use the word could increase? Go figure out what is increase and then bring that here. And if you do not know, then simply say, we are not aware and we feel that there may be something, but we do not know. Then it makes sense that fine, its toxicity cannot be excluded. I can say that, hey, if you drink too much water, the toxicity cannot be excluded. So you would hear that from me, you would laugh and you'll say, yeah, I get it. This is European Medicine Agency. This is a similar kind of thing that NIH did over here. Or if I can ding, do you know the most anger I have is towards American Medical Association, EMA. EMA had said hydroxychloroquine should not be used. EMA had said that pharmacists should not dispense hydroxy when a doctor prescribes it. Then EMA took it back somewhere in November of 2020 to say we had no right of stopping a doctor from off-label use, but they had already done the damage. So anyways, this is what European Medicine Agency is up to. These are weird times. Okay, so let's see. Any questions here? And Paul says, we need all of these doctors on a stage for a knockdown, drag out debate. It's just so. So here's the deal. Nancy's always looking for the F bomb. So here's the deal. Here's the deal. It is safe enough. Let doctors use it in an off-label way. If you cannot effing, I'm talking about the CDCs, FDAs, and EMA. If you cannot effing do your job, then let the doctors use it in off-label way, and let them talk with their patients and figure out what is right and what is wrong. Making such statements is just so prohibitive. It is so concerning that it causes a normal person who may be willing to take it become upset. So Sandy says that Emma is letting us down. Absolutely. So EMA is letting us down. EMA is letting us down. CDC is letting us down. NIH is letting, FDA is letting us down. WHO is lost somewhere. These guys are just all over the place. So Paul Borg says, how about back to diabetes? So yes, today's discussion day was not for the diabetes, it was for COVID. So I am doing that. So my question for you, Friday, Saturday for other things, which at this time are diabetes? Mr. Beast says, hey doctor, is the oxygen supply to lungs will decrease when we took COVID-19 vaccine? No. Why would oxygen supply to lungs would decrease? No. Yeah, that is true. Absolutely. Emma should do their effing job, and they are not. They're playing games. Preach, Dr. Bean. Yes. Yes. So, Sapal Steve, I think you've been facetious here. Janet Taylor, hold off on ivermectin until after the studies. Good luck. Yeah. Money talks. It is about money. Okay. Trying to see any questions here. Marie, doctors are being forced to not prescribe ICQ or ivermectin because of the Orange Man bad. As much as there is political aspect of this all is, that all is also a facade to just use that political person to then fulfill your own agenda. Agendas are different. Aliji says, Dr. Bean, please record some lectures in Urdu for Pakistan and India. It will be very helpful for them. I had actually done one lecture in Urdu that is about allergies. I think it is type 2 or type 1 allergic reactions. And I did not see a lot of engagement in that. So because of that, I didn't do more. So Kellen is saying K Molier 504 has a question. So let me go find it. Jenna Taylor has a question. Continue ivermectin, going for endoscopy Wednesday and biopsy and labs and abdomen X-ray today. Abnormal gastro doctor. Thank you. Okay. So continue ivermectin. Again, me not being your doctor can't say it, but if I have a patient, I would ask them to continue with ivermectin. Trevor says, did you ever talk to someone at Sanitize? Not yet. I just didn't get a chance. Hi, doctor. I read that COVID can cause the onset of type 2 diabetes. If so, what would be the mechanism? COVID can cause, so again, inflammation. There are ACE2 receptors in the pancreatic cells as well. And if the COVID has become rampant, then there are two ways for anything to cause diabetes. One is it is possible that sometimes people who are acutely infected by viruses or bacteria or fungi, they can become acutely diabetic because of the stress hormones that are making the tissues insulin resistant, and that causes hyperglycemia. Similarly, steroid usage. So when a person in COVID is given steroids, that can cause also insulin resistance and hyperglycemia. These are temporary and a person should become okay. Similarly, a person who is undergoing COVID, let's say it happens to me, that 1 week when I thought I had COVID, it was stressful that I have COVID. I can become serious anytime and end up on a ventilator. So that would cause stress hormones, and that would also cause possibly stress hormones and insulin resistance and diabetes. Then, if the infection itself is destroying the pancreatic tissue or causing inflammation in the pancreatic tissue and the tissue cannot function correctly, that would also cause diabetes. And COVID is known to affect pancreas. And I had that discussion yesterday. I would say it once more. Let me share my screen. And they saw this effect that I'm going to discuss now for other coronavirus diseases. So let's say here we have a pancreas. And let's say this pancreas has about billion beta cells, right? These beta cells are responsible for making insulin. Now, let's say with age, we will continue to have, I'm going to use this, we'll continue to have some part of beta cells getting destroyed as they're working with age. And let's say, I'm just going to make up a number. Let's say by age 60, now it is not necessary. People who can have a better diet or exercise, they can sustain and hold on to their beta cell. But let's say at age 60, somebody who was obese, somebody who had lots of fats, somebody who had been taking fats and then carbohydrates and some unhealthy things, or maybe infections like COVID, and they caused, let's say normally by 60 years of age, our beta cells have cut down to this. So these are gone, these are still there. So they are barely enough to provide enough insulin, but they start becoming deficient because they're not enough in number to provide the right levels of insulin. And now we need to have metformin-like things, or we need to have other drugs to either make the peripheral tissue more sensitive or kick these cells to say, hey, make more insulin, which would make them die more earlier, or provide insulin from outside. Now imagine that COVID comes in and destroys this part of the pancreas. By this part, I mean a certain percentage of pancreas or cells are destroyed by COVID, because these cells have ACE2 receptors on them, and COVID can cause infection there. So they are gone. Now a person, let's say this person was a healthy person and they were 30 years of age. Now they're actually living with this much of pancreas. So do you think that they would reach only this much destruction by 60? They might actually have this much pancreas left by 60. And now they might become diabetic much earlier. So this is a possibility with COVID, not only an acute time stress and diabetes, either stress diabetes or a diabetes because of damage, plus in the future, it is also possible that diabetes would occur earlier. So hope that answers that question. Saple Steve says, hit the like button. Yes, please. K. Molier 504. Dr. Bean, hypothetically, would it be too late to start the Math Plus protocol for a 40-year-old obese patient that has been on a ventilator for 13 years with 13 days with no improvement, no other organ failing? So my suspicion is that somebody who is on ventilator, they are already receiving steroids, they have already received remdesivir, if the reason is COVID, and they have already received other COVID regimes. The only thing probably left is going to be ascorbic acid and methylprednisolone instead of dexamethasone, and maybe melatonin and those things. If they're not improving, these things may not be sufficient, but their vitamin D levels and ascorbic acid levels should be corrected generally. Hopefully they're receiving anticoagulants, they're receiving steroids, and it is a difficult situation because now the problem is balancing out the oxygenation versus hydration and protecting other organs. But yes, it should be started. Very difficult disease. I saw. So, little girl says, "Do you suggest someone who is otherwise healthy to take the vaccine even if they feel perfectly fine?" So, again, I cannot suggest to a specific person, but hypothetically, if you see people who are becoming, it is known that folks younger than 50 or 40 handle this disease better and with lesser severity, but there is still chance of becoming a long hauler. There's still chance to end up on a ventilator and death. So it is really for their doctor and them to figure out that what is their age, what is their health status, and what are their risks, and then based on that risk, that person should decide that should they take a vaccine or not. Kideen SNR says, could you explain how CHAdOX1 recombinant in AstraZeneca works, please? So I have actually, let me show you. I think you would like it. I have done a video. If I go here and I say Drbeen AstraZeneca, so this is AstraZeneca and our nucleus that will, when the adenovirus injects the nucleus, the DNA into our nucleus, does it cause any harm there? Then this is AstraZeneca, generally how it is formed, how the recombination occurs, how the that adenovirus is formed. Then this is why the AstraZeneca was 62% effective and 90% effective and then 72% effective. So there is a number of discussions that I have done. Is there fetal tissue in AstraZeneca? So I believe for your question, the answer is in this video. This one. So here I have discussed this in detail. Intestine don't like COVID. Yes, so because COVID can cause gastroenteritis. So think about it, when the paper had come out that you take hot water and that would cause the virus to go into the GIT and then the acids would destroy it. No, this is a virus with an envelope with rich set of lipids on it, and it can be saved in the stomach from the acids and then continue. It can actually cause gastritis. It can cause infection of the stomach and then infection of the intestine, gastroenteritis. So yes, you're correct. France says, there are so many of these events. Humans are not the sharpest tool in the shed. Yes. Pasi says, here even Dutch politicians that have YouTube videos showing UK variant is not worse get taken off YouTube too. This is just weird, very weird time, dark time. LEG says, question, is vaccine safer for low blood pressure patients? Depends what is the reason for the low blood pressure. So imagine if the low blood pressure is because of the cardiac failure, then vaccine could trigger myalgias and fatigue and inflammation that might put stress on the heart. So in that case, it can be an issue. Although it has not been seen except very fragile, but I do not know how fragile this person is and how low the blood pressure is, and if it is common for them or if it is because of a pathology. Similarly, blood pressure could be low because of low blood volume, and that is because of maybe some renal issues where they are losing proteins from the kidney because of the kidney failure, and then the water is going out or water is accumulating. So it really depends what is causing the low blood pressure. They have internal bleeding, internal wastage of fluid, internal collection of fluid outside the blood vascular system. So if any of these are pathological conditions causing it, then vaccine can tip that person's condition over. Love Bean says, just say hi to everyone. Hello back to you as well. Uh, there is a Machiavelli says a more stable spike protein causes more infection. More stable spike protein. Are you talking about vaccine producing a stable spike protein, or are you talking about a virus with the even further? I won't call it stable. It is still, even wild type has stable, more infectious, more contagious. Um, then yes, it could be. Mr. Beast says, "Are you an Indian?" No. Uh, Tuber Sterini says, "I'd like to know how vaccine makers plan to test boosters for the use against variants and how these boosters would be administered." I think so. Again, I'm speculating. I may be wrong. Just like flu shots, they would just look at in the lab what is the change in the virus, and based on that change, they would change the RNA. Based on that RNA's change, they would produce a new vaccine, and now that vaccine booster is given. Govind Tomar says, "I have asked my question 5 times, you're ignoring it." No, I'm not ignoring it. I just didn't see it. Um, Govind said, "Doctor, you just only take some, which are your regular cool bean." No, it's not that way. Uh, Lewis says, "How about fasting autophagy, autography? Could it help long haulers people? A few people reporting getting better after a few weeks of following such protocol." So it has to be checked. I am still figuring out how the long haulers that have become persistent, how to help them. So maybe there is something here. Judgment Care USA says, "Dr. Bean, I believe you experienced a mild case of post-COVID syndrome." Maybe. Interestingly, the antibodies are negative. So, Colin, one of my sons has Edward syndrome. Jose, can he take a vaccine safely? So, again, you know that I can't be specific, but hypothetically, any patient who does not have an immune system disability, either on the allergic side or too much on the lower side, is fine. So Jenna is saying, yes, that's what I may have. Thanks. So if it is gastroenteritis, Jenna, hopefully then that can actually be taken care of. The good news with the gastroenteritis is that things like ivermectin can help. Plus, the GIT layers are shedded; they shed all the time. They're replaced all the time. So there is a chance to actually remove the virus from these layers. Chris says, "My doctor told me that I have a fatty liver. Do you think it's safe to have a vaccine with fatty liver?" So again, I cannot advise you. I cannot provide any advice or prescription for you. Generally, fatty liver, once again, depends how much is it fatty, meaning what is the outcome. Liver does participate in some immune reactions. For example, you know that when the acute phase reactions occur, when the infection starts, we go to liver and we say, "Hey, can you please make more acute phase proteins?" And then it produces those proteins, including C-reactive proteins, ferritins, and other things. So, or takes part in the ferritin metabolism. So if the fatty liver is sufficient that the liver functions are lower, then vaccine itself has no issues with that. Vaccine is just going in and triggering the immune system to say, "Hey, make more antibodies." It is the drugs and other interactions, and that must be interesting. So that should be discussed with the doctor. But generally, vaccine does not care for the, is not affected by the fatty liver. So Edmund HR says, "Is it okay to drink alcohol when having the vaccine? Would it reduce the immune response?" No, no, it will not. Can COVID induce autoimmunity? So that is a question that is still out to be discussed or figured out. Is it possible that the long COVID is an autoimmune reaction, or is it possible that it is the COVID virus, not COVID, it's the SARS-CoV-2 virus hiding in some cells to which immune system is responding, or is it the immune system dysregulation, which we say in immunology we say hit and run by the virus? Is it that? So it could be any of three or a combination, and that still needs to be figured out. So Lisa says, Dr. Bean, could you explain why pediatrics doctors are now adding two pediatric protocols not to push too much liquids to kids with COVID-19? Actually, this is not just for the pediatrics, it is for adults as well, that the struggle that a doctor has to do is to keep the patient dry while keeping them alive and prevent organ damage. So the basic problem is this, that as the COVID infection first hits the lungs start become edematous and they start become congested. That means they start becoming filled with fluids and we start drowning in our own fluids. Now the solution for that is what? The solution for that is to drain the fluid. And to drain the fluid is by doing what? Number one, restricting the input fluid. And number two, increasing the output fluid, that means urination. The problem with that is that as the ARDS or acute respiratory distress syndrome is occurring, at the same time cardiovascular system is going down as well. And so now the blood pressure is not maintained sufficiently. And if the blood pressure is not maintained, the first tissue that is going to be destroyed is kidney. So now doctors have a problem that to keep kidneys going, they need to keep slightly higher blood volume or fluid volumes. And to keep blood pressure high enough as well for good perfusion, they have to have a higher blood volume or fluid volume. The increased fluid volume then also reflects in the lungs, and the lungs start filling up again. Imagine if the lungs have become injured pieces of, they're injured pots, their sieves, their filters, the fluids are just filtering out. And now the patient starts drowning. So on one end, the doctor have to remove the fluid to dry up the lungs. On the other end, when they do that, then the kidneys and other tissues, heart, and then possibly brain, liver, other tissues start dying, and they have to help them by perfusing them. That is a problem. So it is not just pediatric, it is for adults as well. So this was a very early on. I still remember I had a discussion in April-May timeframe that part of the management is to keep the patient dry and still keep their blood pressure sustained and their kidney sustained. And that's a very difficult thing to do in ICUs. That is a majority of the reason that people die. So Machiavelli says restrict sodium or something. They have to do much more. I mean, sodium restriction is for us healthy people who are able to walk and talk and go and reduce. In a patient who's sitting lying down in ICU and is unconscious and their body levels, fluid levels are all out of whack, they have to be given things like Lasix or other diuretics. The problem then is potassium's imbalance, then we have to give potassium sparing diuretics. On the other hand, if you give diuretics and the fluid level go down, that causes other issues. When you try to manage that, then the lung starts becoming drowned. So it's a continuous battle. Mike says, Dr. Bean, are you a closet anti-vaxxer? Not at all. I am actually waiting for I wish I'm not given AstraZeneca. I'm not a fan of AstraZeneca. So if it is AstraZeneca, I may be an anti-vaxxer. But other than AstraZeneca, I am a vaxxer. Why do you say that I may be closeted anti-vaxxer? That is funny. Um, Rima says viral debris, ivermectin, inflammation, immune dysregulation. Viral debris equals ivermectin, inflammation, immune equals steroids. So virus itself or its debris, ivermectin, correct. Inflammation, dysregulation, steroids. MCAS, H2, yes. Brain fog, fluvoxamine. Is that the core? Plus steroids, plus anticoagulants. Then the core. Plus keep the ascorbic acid there, plus keep the vitamin D levels correct. That makes the basic core. And then it is a fight of oxygen plus fluid level maintenance. My name is Psyche says, is monoclonal antibody safe? Would you recommend it? So it is safe, not very effective, but still used. So yes. Mr. B says, do we want to control the intake of food after taking vaccine? No, not at all. Sable Steve says, make Luffy happy, hit the like button and smash the bell. Yes, hit the like button and smash that bell. Yes. Michelle says, is it possible for the body to react to the vaccine by choosing the cytotoxic pathway and thus not produce antibodies? Possible, yes. Because at the end of the day, it is a part of the virus. So if the spike protein response could go T helper 1 pathway, then yes, it can happen. If Freya Carter says, is there any cause for concern with the person who have thyroid problems and taking the vaccine? Thyroid, look, there are two problems with the thyroid, hypo or hyper. Hypothyroid reduces the body's actions. So the person becomes, their basal metabolic rate goes down. So every cell in their body is not functioning at par. So if to such person you give vaccine, their immune cells are also not going to respond very correctly, and they're going to be all like, oh man, I'll work tomorrow maybe. On the other hand, hyperthyroid is when their system, all cells are working extra. Their heart is going fast and they're sweating and they're all jittery and the muscles are twitching because the basal metabolic rate has gone up. And so for them, when you give the vaccine, their immune system cell would respond more as well. So it really depends what is the problem. I would have, if there is a patient of mine, I would first correct their high thyroid levels and then I'll send them for vaccine. So Harris says, it seems that the standard of care changed after COVID. Do you think just starting early treatment with ivermectin will prevent more severe cases, deaths, and turn long haulers? That is the belief. And that is at least from my own practice, so which is not a study. My own practice, I've seen that using ivermectin prevents long hauling, recovers patients quickly. So there is a possibility for this, yes. Closet Picker says, should I double up my thyroid pills on vaccine day? So I think the important thing is for all of us to keep our vitamin D level correct, with calcium level correct, and thyroid levels correct. Dr. Griffin says, Dr. B, how's the feedback from the FLCC video been? So one, why wild virus recovers being given 2 vaccines. Let me get back to you in a second. Let me show this. And Rima, once again, thank you very much. So if you go to FLCCC Press, and then if you see here, this is the video. So 3 days ago, it was uploaded, 40,000 views already. To put that in perspective, for me, there has been never a video. Well, I shouldn't say never. There have been some times, but I usually don't have a video that I would upload today and within 3 days would have 40,000 views. So they have 40,000 views. That is a very decent number, considering that they only have 3.2 thousand subscribers. So they're an early channel. Still, they have a very good viewership on this one. So that is good. So that tells that there is a good outcome. And the tweets that I saw from them, these tweets were very positive. They had been saying that, hey, great job. And then if you see the comments here, these have been very good as well. So I think there is a positive outcome. So Rima, I'm going to go to your question in a second. John Morris says, after vaccination, is protection an absolute of fully immune, unprotected for the person, or may a person just be able to tolerate a higher inoculum? Very good question. Protection, if protection has been produced, that means if the immune system has been trained, then it is an absolute term, because immune system does not need a specific dosage once it has become vaccinated, meaning vaccine has to have a dose which is enough to trigger the immune system. But once the memory cells are produced, memory cell can very rapidly increase in number and rise up to the level of the monster that came in, as long as they know who's the monster. So let's say that somebody who comes who receives the virus afterwards and gets a higher dose, these cells would very quickly increase in number to match that dose. That is the benefit of either an infection or the vaccine. So I had a question from Rima. Let's see. Okay, so why are wild virus recoverers being given two vaccines? So Rima, tell me more. Are you saying that, let's say if I had the wild virus infection, then I am given vaccine, let's say Johnson and Johnson, and I'm also given Moderna? Is that what's happening? Maybe they're trying to see that the new variant may be covered better by another vaccine. So Sepal Steve says that's a very good question. Have you checked on how COVID continues to affect countries around the world lately? Let's check it out together. And Denise said, and citrus can be irritant for mast cells in some people. Ed Mohan's, it is just going very fast. Ed Mohan had a question. Should we continue zinc, vitamin D, vitamin C, quercetin after being vaccinated? So generally from the virus point of view, you can quit. But generally to keep your immune system balanced, even for other things too, I think we should keep those things going. And it is interesting for me that how other infections are now reducing. So let's look at the world around us. So if I go here, so worldometer, and we start with Israel. Daily new cases. Wow, look at this. They are low. If I say 3-day moving average, it is down. 7 days moving average, it is down. It was almost, it is still higher than this automatic natural dip, but it is down. Look at this, active cases. I love it. They're so few now. And I'm sure that deaths are not as down as I would have expected, but still down compared to where they were here. So that is Israel. US. 30 million cases. California, where I live, is the top of the list. And look at this. Not the best, but still quite down from where we were. Active cases have not gone down that much. but trend is downwards, and daily deaths are reducing too. So better, this is much better than being here. I think it would continue to go down. So after that, let's see UK. Wow, very good. Is it the lockdown, the strict, stringent lockdown with no therapies, no ivermectins, no vitamin Ds, just lockdowns and vaccines? Much, much better. Look at this. I love this. Look at this. 17 deaths. I wish there was zero. I think they are going to reach there very soon. This is good. So UK is doing good. How about what else? UK, US. How is South Africa? Oh, look at this. Sustained down. Look at this. Really down. Good. Although they have a new variant there. So why is it? Is it the um, lockdown, or is it the ivermectin, or is it vaccination, or is it just the herd immunity developing? Does anyone know? Let's see. Tell me which country. India? How's India doing? Wow. Why are they developing another wave here? Is it because people have started becoming less careful? See, their active cases are going up. Of course, the number of deaths are following them as well. So India seems to be. How is Brazil? Brazil. Oh wow, this is not good. What's going on in Brazil? This is not good. Look at the active cases increasing. We have worldwide. Look at the number of deaths. Maximum. They are at the all-time high. Why? What is the vaccine level? Vaccine tracker. Are they not? So let's say no vaccine. Are they not doing lockdowns? What is going on? Vaccine tracker, Bloomberg. So let's see. We were looking at Brazil, correct? Is Brazil not administering vaccines, or am I not able to find them? So that's interesting. What's going on with Brazil? If I said, where is Brazil on the world map? Tell me. There. I knew it was somewhere over here. So Brazil, 16 million doses given, enough for 3.9% of population. So really low vaccination. What is the number of cases in Brazil? 12 million cases and 16 million doses. So let's say for about 7%, not sufficient immunity. Are they not taking care of the society, meaning lockdowns or ivermectins? Why is it so bad? So that's really not the best in Brazil. So Loretta says Brazil has political issues. But what is the issue, Loretta? Are they keeping the country open? What's going on? Christine says Brazil can't get vax agreement as they're not slowing indemnity. They're not allowing indemnity. Huh. Very interesting. So in the meantime, people are getting sick and dying. So Lisa says a doctor from Brazil told me that they will hit 5,000 deaths a day. No lockdowns. That's not right. Really, Brazil's leader is a COVID denier? We still have COVID deniers? Simple Garden says, "Oh my God, we've discussed this before. New government and also not using ivermectin anymore." But that's the thing. Are they not looking at what's happening? Are they not learning a lesson to say, okay, now we need to change course? Sorry if I frustrated you. John Snyder says, President of Brazil was spreading misinformation on vaccines. They asked the US for some AstraZeneca over the last few days. Their country is in trouble. Eddie says, Dr. Bean, are you a pro mask? Yes, quite a strict pro mask. So they signed something to get, they need to do something fast. Not following social distance, mask, everything is going well. Then the society itself is also not helping. So Denise says, look at the USA Eastern Seaboard. Are we in the similar situation? US has a lot of damage as well. Ali says, a lot of respect from UK. Thank you very much. Mark says, I'm pro donuts. Very good. I believe the president of Brazil. Okay, so Jem says that economically Brazil cannot afford a shutdown. People have to work to live. Brazil doesn't have or not using therapeutics. There are many other countries, for example, India or Pakistan, where people need that. Why are you pro lockdown? Studies show that didn't help. Which studies? Look at UK. Yes, I know that Brazil has that variant, but still, when a variant zips through a society, it would create herd immunity there. That is sad. He told Brazilians to stop whining. That is sad. Okay. So, what else should we talk about? Massachusetts is over 2% positive. Or should we break for now and then meet again tomorrow? Eddie says, masks do not work. Okay, Eddie. Um, so, this morning I was talking with European cool beans, and I was saying that there are studies dime a dozen for everything you want. So Yaspal Grover says maybe diabetes again, or is it done? No, so we will continue with diabetes, but not on a daily basis. So the question to the team here is, should we divide half and half? So let's say Monday, Tuesday, Wednesday, we talk COVID, and then Thursday, Friday, Saturday, we talk diabetes and aging and other topics, or just switch to other topics, or continue going with COVID and 1 or 2 days for diabetes. So please tell me, how would you like? Cool. Machiavelli says we're getting there, but the younger crowds are acting selfish. Yes. Are you, Machiavelli, you're talking about the US? Ivermectin. So, Cynthia, we will continue to talk about the other topics as well. I think we should just make a calendar to say Thursday, Friday, Saturday, non-COVID topics. For example, at this time, diabetes. So, give me your opinion. Please type your comments. And with this, I think that there was someone who said, Zelena, Z-Dog versus Vanden Bosch. So did you hear Z-Dog? Z-Dog made so many mistakes in his message as well that if he stands versus Vanden Bosch or Geared, Z-Dog is just going to fall flat so quickly. So Z-Dog's message, the summary is correct. His science was wrong. I listened to that. Just like the Geared science is wrong, Z-Dog's science is wrong as well. So it is two people. One is saying 2 + 2 is 6. Other one is saying 2 + 2 is 5. And they're going to debate with each. If they debate with each other, it will be interesting. Lisa Peacock says, hit the like button. Yes. Dogfight. Yes. Judgment Care USA say, I would like to hear other topics, but with info as how they relate to COVID and other infections. 2 wrongs make a right. Chuck says 2 wrongs. So if, just to give you a hint for how to see where Z-Dog is wrong, I didn't want to give this hint because then if it reaches up to Geert, then he would pick up. And I'm sure that Geert would already know, if not now. Z-Dog said in his discussion, so please listen to him once more, and he said that Geert talked about the innate arm. And he said, I know that he's talking about the NK cells and T helper cells and other T cells. And these are, and he kept calling it all the innate arm. And I was thinking that even our cool beans who are not doctors know that NK cell, the neutrophil, macrophages, dendritic cells are part of the innate arm. T helper cells, T helper 1 cell, T helper 2 cells, memory T helper cells, B cells, plasma cells, cytotoxic T cells are all part of adaptive arm. So Z-Dog kept making that mistake while he was talking. And I was thinking, if he stands in front of Geert, he's going to be destroyed in a second. Similarly, if Geert stood in front of somebody who knows immunology, Geert does not stand a chance with his mechanisms. So it's interesting. Okay, so this we should talk separately. Francis, I caught that too and was laughing. So imagine this, that if he was making this simple mistake, then imagine the remaining gaps in the in his knowledge for immunology. That doesn't mean he didn't read immunology. He must have read it in his school, but then he has not brushed up. And that also doesn't mean that Geert has the correct immunology. He's also making a lot of mistakes in his immunology connections. And it was funny that the folks who support him, they keep sending me messages that, hey, Dr. Mubin, Geert is beyond your depth. And I was saying, yes, he is at the drowning depth. So they both have the mechanisms wrong. They both have them wrong in different ways. Yes, Rima Z-Dog is a doctor as well. Quite a popular doctor. These all guys, other than Geert, these all guys are actually much, much more popular than I have ever been. Z-Dog's videos have been watched, I think, more than 500 million times. But That doesn't mean that if somebody is watched more, then their mechanisms are correct, or somebody who's saying louder things, their mechanisms are correct. Mechanism correction book. You take the book and see what is in there, and then you apply studies on top of it. Texas Max says, I had immunology 45 years ago, caught up with Drbeen. Yeah, it's ridiculous. There are so many issues with. Andrea says, how old is your cat, Luffy? So Luffy and Kyrie both are 6 years old. Cool. So, I'm just trying to see. So Bambi, so these are very, very specific questions. What about complete thyroidectomy and jab? No problems. I believe that when somebody has a complete thyroidectomy, they are given replacement hormones, and their levels are corrected. So as long as the replacement hormones are given and the levels are correct, they should be treated as normal. Art Patron Forever says, is it reckless to take chance for adverse reaction to vaccinate people already having acquired immunity? Acquired immunity to what? The virus? If somebody had the virus and has recovered and is healthy, I don't I don't believe they need a vaccine. Um, so Leda, I know that some folks have been asking me to look at Medicago, and I have not, even after um, keeping it on my radar. It's just so much to do. Rubies, sure. So I have taken note. I wanted to do, there is another study with vitamin D, and I thought that was very, very important. So I wanted to do that study, and I think I should talk about Medicago as well. C. Davis says, at some point, a time, can you discuss why Geert is incorrect? Sure. So I asked over this weekend if folks would like to see the issues with the mechanism. I asked that on Patreon and I asked that on YouTube. In both cases, majority of the people said yes. And what I liked was that Cool Beans said, just for our knowledge sake, um, maybe in one case, someone said that, why don't you debate him? And I said, I'm not interested in debates. I'm interested in the knowledge part. It is like this book would not say that I need to go and debate someone. I'm presenting knowledge. I would present knowledge. So for Cool Beans, I think we are all a reflection of the same thing, that what is the knowledge? What is it that we can verify from the books and see what's in there, and then be aware. I think that is as much as my agenda is. My agenda is not to go have debates. Uh, I remember there was a person who became very upset with one of my medical concept I shared, and he said, "I want to debate it." That was the funniest thing. He had, I think, he had bought a Dr. Bean subscription as well for $97. So when I refused to debate him, he said, "Give me my money back." I said, "Okay, I'll ask my team to refund your money." He did not even wait for that, and he went to the bank and he said, "I need this transaction to be cancelled. He's done a fraud with me." So bank actually canceled the transaction. Then he said, "Don't need to refund it. I've gotten it." Then he wanted to ask me where I lived. He wanted to he got my phone number. He started sending me messages to say, "I want to debate you." it became quite an issue. So uh, I just don't debate. I am not interested in debates. I'm interested in medical concepts. And the onus for the proof, when I discuss something, in the beginning, I was not putting the references with my videos. But if you know, whenever I talk, I put a reference. Here is the reference. Now, if that reference is wrong, I'm wrong as well. If the book is wrong, I'm wrong as well. But I do that with for gear. There have been many mistakes, and there are no references to that. So if I'm still for it, and many cool beans actually responded and said, just forget about it, and that's a waste of time. So if there are, and I didn't see enough engagement of this on this question, maybe 100 200 people responded, and maybe on Patreon 10 20. So I didn't see much interest. But if there is sufficient interest, we can have a separate, I would like to have a Zoom call, so that the cool beans that are present can actually ask questions verbatim and say, so what about this, or what about that, or how about this, and we can discuss it. That I can do. But if somebody says you need to go and debate Z-Dog or Geared, that I think is just not useful. Okay, so Saple Steve says, Luffy Muse, to hit the like button. Yes, please hit the like button and smash the bell as well. That is strange. Months ago, Z-Dog mocked us and said he wouldn't be huffing ivermectin or snorting hydroxy. It made me mad. He is a character. So let's see. If we go with Bosch saying, hey, take NK vaccines, that is just rubbish. There is no NK vaccine. If he says, don't give vaccines, that is also not correct approach. The mechanisms to support that is also not correct. So I do not know exactly where should we stand with that. But, oh well. The thing that I can do is to just go over the writing and just line by line, concept by concept, discuss it to say why it may be correct or may be incorrect. Akhil says, is there any issue with folks taking Covishield, AstraZeneca formula when they have a penicillin allergy? So that is actually for your health authorities. For example, in the US, they have said if you have severe allergies, please don't take the vaccines. So it has to be known from the vaccine and doctor and administering. They should know. You should tell them, and they should then come back and discuss it. Cool. So Nima says, I think you can book paid consult to go on this forum. These chats are always free, and he spends my time helping us. Yes. Texas, different backgrounds can help keep me straight to which topic yet. Cool. So Debbie, I see your question. One with simple cyst on liver, still prophylaxis with ivermectin. Also, what is a steroid pulse? The liver's job is to pick up ivermectin and take part in the metabolism. So cyst itself doesn't mean anything unless the liver functions are disrupted. If the liver function are disrupted, then all drugs need to be carefully administered. So it really depends upon the situation. If the liver functions are fine, then cyst doesn't mean much. Cool. So Roller Girl, when can we Zoom again? This Friday. So we'll Zoom every Friday if it is fun. Lisa says that yeah. Yeah. So Conan says, would you be doing? Yes. So I am going to do the European and Asian bean talk tomorrow morning as well, and then we'll continue. So Eddie says, can you look into cross immunity from previous prior vaccinations or exposure to other coronaviruses? Per CDC, up to 70% could be asymptomatic. Doesn't this mean we are close to herd immunity? So Eddie, that's a very good point, that there is a lot of possibility that people may have gotten the infection and recovered. And I have been lamenting about this for a long time, that there should have been booths on the side of the road where you should be able to go there and say, check me out. And they should check your blood and tell you you have it or not. For their own purpose, it is very useful. And so, yes, maybe we are reaching that. No way to tell. These were just simplest things to do. We needed something exceptional to happen, and that didn't happen. We had a very run-of-the-mill, average, mediocre response by our healthcare authorities. Let's make a vaccine and let's give them vaccine. Meanwhile, everybody sit home. Fine, it was useful to sit home, but that was a mediocre response. There could have been, for lesser amount of time, with lesser budgets, with lesser money wasted, we could have made booths to test vitamin C's and vitamin D's and the COVID levels, antibodies, and to provide help through advertisements. And we could have, within 3-4 months, we could have gotten it under control. And anyways. So thank you very much. Thank you very much for today. So Ian, this is a good question. And I was actually asking someone yesterday or day before that why are they not giving ivermectin in UK? And they were saying that they are just complying with the UK health authorities and they don't believe in ivermectin, so they cannot. So the only way they're getting ivermectin is people individually going on websites for India and then buying from India, which again, hopefully they're getting good quality product. So Lisa says, from you, it will not be a debate, it will be clarification knowledge. Yeah, so if we just wanted to sit down together, huddle down together, and just go over these things to kind of discuss between us. This is why I want to have a Zoom call where we can talk with each other, where someone can say, hey, Mubin, you just said this, what about this? And we can just explore this together. That, to me, is studies, education. Debates are just nothing. Good night, Margaret. I hope that you are doing good. Cool. So let us break for today. We'll see each other tomorrow. Please like, subscribe, and share. There are 3 links in this description. One is to buy me coffees. The other one is for Patreon. And the third one is to support this work. Thank you very much. And I would see you tomorrow. Bye-bye.